structure right here is your bony pelvis. This right here, all the red that you see, is your pelvic floor. My name is Dr. Tanvi Maharaja. I'm a board certified specialist in orthopedic physical therapy and a pelvic health specialist. Today we are going to talk a little bit about the pelvic floor. The pelvic floor is the base of the bony pelvis. It's made of 3 layers of muscles and it supports the pelvic organs, the bladder, the uterus with the fallopian tubes, the ovaries, and the vaginal canal, the rectum, and the anal canal. Pelvic floor, once we remove all the organs, has 3 openings in women and 2 in men: urethra, the vagina, and the rectum. Urethra and the rectum in men. The pelvic floor serves some very important functions. It supports the pelvic organs, being the base of the pelvis. It has also a very important role to play in sexual function. And last but not the least, it's a part of your core. The pelvic floor can sometimes go wrong. There's some dysfunctions that might happen with the pelvic floor. In the ideal world, the diaphragm or the breathing muscle and the pelvic floor work in synergy, so that when we breathe in, the diaphragm and the pelvic floor descend together. When we breathe out, they both go up together. Work in this nice synergistic way all the time. If there's issues with this synergy, there can be problems in the body: incontinence or leaking, or pelvic organ prolapse. If the pelvic floor, on the other hand, is too tight, it can cause pain conditions: tailbone pain, low back pain, hip pain, even sexual pain. And a lot of people have constipation, urinary urgency and frequency just because the pelvic floor muscles are tight, short, and working overtime. Pelvic floor physical therapy can be super helpful in almost all conditions. Here are some tools that we commonly use. This here is a dilator, and it comes in 2 sets, the small and the large. Some people need a pelvic wand. You see how that is S-shaped? Because the pelvis is not linear. It has nooks and crannies and curves. That last item you see there is the Kegel weights. They are used for exercising the pelvic floor muscles. This is the O-nut. This is another thing that the partner of women can use in cases of sexual pain. As a pelvic floor physical therapist who specializes in pregnancy and postpartum rehab, I work with a lot of clients who have difficulty with pregnancy. There's the whole postpartum section of women, where women could have perineal tears or episiotomy and even C-sections. I work with women who have leaking issues. Some women have fecal incontinence after pregnancy. All of this can be managed with pelvic floor physical therapy. I'm also specialized in fertility rehab. These women benefit greatly from mobilization of the reproductive organs, known as visceral mobilization. So I treat women from the whole range, from before they get pregnant to a healthy pregnancy to a safe postpartum period. I treat menopausal women. So through the lifespan, women need help. They need support because women's bodies are constantly changing. Medical help is sometimes really crucial in bringing back the quality of life that women seek and deserve. And one of the biggest challenges that a patient has is that they cannot see their pelvic floor. As a therapist, I can do a vaginal or a rectal assessment and help you cue into your muscles. This is where real-time ultrasound comes in. Using real-time ultrasound, I can show the patient their abdominal wall. We can look at bladder volume, which means we can see if women are retaining urine even after peeing. We can look at the back muscles or the multifidus. And of course, we can look at the pelvic floor. I worked with a patient yesterday who had a very tight pelvic floor and she was unable to lengthen it and descend. And when we do the ultrasound, we can make a graph of how much descent she has. She was barely 4 millimeters. I worked on her breathing muscle. We did a diaphragm release. After her diaphragm was released, she could breathe better and her pelvic floor mobility increased to 16 millimeters. Ultrasound is a game changer. I have been doing pelvic floor for a long, long time, and ever since I started using this, people are having those aha moments. It was really nice to meet you, and I'll see you at your next session. Remember to drink plenty of water, no hovering on the toilet seats. You gotta sit down, and lots of fiber. It was nice meeting you. Thank you for coming to Pelvic PT Plus. for all your physical therapy needs.